Introduction. The skin is the largest organ in the body and serves a variety of important functions, including protection from the external environment, regulation of body temperature, and sensory perception. In order to understand the skin and how it functions, it is important to understand its anatomy. One. Epidermis. The epidermis is the outermost layer of the skin and is responsible for protecting the body from the external environment. It is composed of several layers of cells, including A. Stratum corneum, B. Stratum lucidum, C. Stratum granulosum, D. Stratum spinosum, Stratum basale. A. Stratum corneum. The top layer of the epidermis, which is composed of dead skin cells that are continuously shed and replaced. B. Stratum lucidum. A thin, translucent layer that is present in the palms of the hands and soles of the feet. C. Stratum granulosum. A layer of cells that produce keratin, which helps to strengthen and waterproof the skin. D. Stratum spinosum. A layer of cells that are responsible for producing melanin, which gives the skin its color. A. Stratum basale. The bottom layer of the epidermis, which contains cells that are constantly dividing to produce new skin cells. 2. Dermis. The dermis is the layer of skin that lies beneath the epidermis and provides support and nourishment to the skin. It is composed of connective tissue, including A. Papillary layer, the upper layer of the dermis, which contains blood vessels and nerve endings. B. Reticular layer, the lower layer of the dermis, which contains collagen and elastin fibers that provide strength and elasticity to the skin. Subcutaneous. The subcutaneous layer is the deepest layer of the skin and is composed of fat cells and connective tissue. It helps to insulate the body and protect the organs. Skin structures. The skin also contains various structures that are essential to its function, including 1. Hair follicle, 2. Sweat glands, 3. Sebaceous glands, 4. Nerve endings. 1. Hair follicles. Structures that produce hair, which serves to protect the skin and regulate body temperature. 2. Sweat glands. Glands that produce sweat, which helps to regulate body temperature and remove waste products from the body. 3. Sebaceous glands. Glands that produce sebum, which helps to lubricate the skin and prevent dryness. 4. Nerve endings. Structures that transmit sensory information, including touch, pressure, pain, and temperature. Conclusion. The skin is a complex organ that is composed of multiple layers and structures. Understanding its anatomy is essential to understand its function and how to properly care for it. Nurses need to understand skin anatomy to assess and manage a wide range of skin conditions, including wounds, infections, and rashes. They must also be able to differentiate between different types of skin lesions and understand the underlying pathophysiology of skin disorders. Additionally, nurses must know how to care for the skin of patients with chronic conditions, such as diabetes and immobility, to prevent skin breakdown and pressure ulcers. Thanks for watching.